Welcome to the Humble Hoof Podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumblehoof.com. A special thank you to our wonderful sponsor, Cavallo. For our Humble Hoof listeners, they are offering 15% off their Cavallo Trek hoof boots using the coupon code HRN at checkout. The Trek is the world's most popular and versatile hoof boot and Cavallo's toughest trail boot, while also doubling as an option for therapy or rehab. The front closure system makes it easily adaptable to various hoof shapes. TPU upper design allows for maximum strength while minimizing weight for the comfort and ease of movement for your horse. These are recommended by vets and trainers and also loved as transport boots by barrel racers, show jumpers, dressage riders, and everyone in between. Again, 15% off a pair of Treks. Use the code HRN at checkout at cavallo-inc.com. Earlier this year, I decided to start interviewing friends and colleagues with horses that have had hoof issues in order to do a sort of success story series on the podcast. We've talked about high-low cases, we've talked about a laminitic eventer, and in this episode, I talk with Carla Anderson. Carla is a hoof care provider based in Wisconsin, and she owns the Gentle Equine LLC. And she, just like me, used to be a teacher, but decided to learn to trim her own horses, again, just like me. And she started thinking that she would just trim her own, but like most of us, it turned into more. And she took a special focus and passion for horses that are dealing with insulin resistance or PPID or both. She is not a veterinarian, but has been dealing with these metabolic issues since 2013. And she follows the same protocol that I do for these kind of metabolic cases that we find on ecirhorse.org with Dr. Kellen and the great ECIR group to get these horses sounding comfortable. So I spoke with Carla about a case that she worked on and how she ended up getting this horse back to comfort. So why don't we get started? And can you tell us a little bit about your background and how you became interested in hoof care?
Yes. Well, I'm a special ed teacher, a retired special education teacher. And my vet came to do a chiropractic adjustment on my horse. And she stopped dead in her tracks and she looked down at her feet and she said, when is the last time she was trimmed? And I said, 3 days ago. And she wasn't impressed because there was, the hind feet were flared. One of my farriers, Cupcake, was having a laminitic episode. I was a client that was on a 6-week schedule always. And she had a flare up and he never called me back for like 2 weeks. And so a couple of those events had happened. And then I decided, I'm just going to do this myself. So I think I was about 57, and I took classes with Ida Hammer.
Oh, awesome. That's great. And so do you now do your own horses or do you trim for other people?
I actually do both.
That's awesome.
Yep.
Yeah, and I feel like a lot of us get into hoof care because of our own horses or having to deal with something that, catches us by surprise and then becoming kind of obsessed with it. So
Right.
So was that horse that you were talking about that your vet came to see, was that Cupcake?
No, that was a quarter horse mare that I have.
Okay. Well, I know that I want to talk today a little bit about a laminitic case that you worked on. So was it one of your own horses?
Yeah.
So, when did it start and what did her first symptoms look like when she became laminitic?
Yes, her name is Cupcake. She is my pony, and this was back in 2013. She was not on grass. We have, dry lots. It's not if they're going to get it, it's when usually. And so I always knew that, was very careful with her. And she just got a little footy. And then it just progressed, and I had her tested, and her test came back 200 plus.
For the insulin?
Yes, with insulin. Yeah. The results were sent to a local lab here in Wisconsin, and they came back 200 plus. And I called my vet back, and that ended up being a pretty tumultuous discussion. Unfortunately, because I was advocating for Cupcake, and I was told that at a recent convention, anything between 200 and 400 in an insulin level was normal.
Oh, gosh.
Yes, and then I called our local lab, which I believe it was like 1 to 10. I'm not entirely sure the recollection there. And then I said, "Well, if this is the case, why are your reference ranges so low if 200 to 400 are normal?" And they said, they basically said they couldn't discuss this with me. I would have to discuss this with my veterinarian. So I called my veterinarian back, and I was not taking no for an answer. I said, ponies are notorious for metabolic, and she's sore and she does not have grass. And then she just said, "I don't know what to tell you." She raised her voice at me. And so then I went to the World Wide Web and found the ECIR group, and I sent them my results, and they said, "Your pony is severely IR, and you need to get her on the emergency diet," which I did.
Yeah. And so
Yeah.
from there, I try to implement that for all my clients, but can you tell us or tell those who might not know what that is, what the emergency diet is?
Sure, been a long time, but it's basically it's on their website, removing any sugars or starches in the diet, magnesium, salt, flax, soaking hay, and then when you can, you should be testing your hay if you can. It's kind of a challenge for some. I did because I buy all my own hay, big bales. And that's what I did. She didn't receive any grain anyway, so I didn't have to remove that, but I soaked her hay and I did the flax and the salt, and we went from there. It's been a long journey.
Yeah. And so did that help for when you started the emergency diet? Did you see an improvement in comfort?
Yes. Yes, I did. I think the soaking of the hay was huge because at that time, I never really had like a grass alfalfa, a strong alfalfa mix, but I think the soaking helped. Then I ended up taking the nutrition courses that Dr. Kellen offers, and I had a lady balance my hay here in Wisconsin, and then she made a remarkable change with that balancing.
Oh, interesting. That's awesome. And so you think that the mineral balancing really sort of took it to the next level?
It did. Mhm. Yes, and then it sustained her for many years, and then it's been an up and down until I would say maybe 5 years ago, 3 years ago now, we're good, but she's 29 years old, so
Right. Yeah.
yeah.
So once she was on the emergency diet, did you see her insulin levels drop to the more manageable levels, or what did that look like? Did you end up testing her again?
Yes, I did, that I would not have a recollection of, but they did lower for sure.
Oh, that's good.
To what value, I'm not sure. I wanna say they were maybe, like, high 20s.
Okay. Yeah, and I think that that's something that I struggle with, or not that I struggle with myself, but with working with owners off property, especially with veterinarians, because the lab ranges are pretty high in comparison to what I see that correlating to comfort. So I think the insulin lab ranges go up to like 40 as normal. And I see horses on my property that are, I had one mare move in that was 28 and she was very footsore. And the last time we tested her, she's been doing better. Last time we tested her, she was at 9. So, which is great. I mean, she is on tested hay and she lives on a track, so she has to move miles a day. So that helps. But
Yeah.
I think that if the owner had just stuck with like, okay, well, 28 is good, it's within range, and didn't try to change anything else, I don't know that she would have become more comfortable, if that makes sense.
Right. Yes.
So that's something that I feel like I don't know. It's
Mhm.
the ECIR group has been amazing at educating me on that and helped me kind of explore more if there's a horse that's sore and not kind of fitting that mold of like, well, this is
Mhm.
technically all good. So,
Mhm. Like on paper.
right, right.
Yes.
So after that, in terms of, you did the emergency diet and she seemed a little bit more comfortable. Was that sort of like where it ended and she was all good from there? Or was there any hiccups or how did that look?
Oh, yes, we've had a lot of hiccups. She was in clogs for a while. This was really early on. And then she can't remember the year. It's been a while. I would say like maybe 2017 or 16. She went pretty sideways and she ended up living in my indoor arena for a year or better part of a year. And her feet just got really distorted and she was still on the diet, that was tested hay and balanced, and she just wasn't getting any better. And then I contacted Dr. Kellen, and that's when she was put on Invokana. Like, I think we're going on 4 years now.
Oh, 4 years on Invokana?
Correct. Mm-hmm.
Yeah, and that one, so it's interesting because that's, one of the SGLT2 inhibitors for people that might
Right.
not know what that is.
Right.
A few years ago, I'm trying to remember if it was 4 years ago. I think it was only 3 years ago. I had a handful of clients that were part of the Tufts trial for Steglatro, which is another
Mm-hmm.
SGLT2 inhibitor. And it was a similar where I had these horses that most of them were on a pretty, what you consider a safe diet and
Mm-hmm.
pretty good management, but still had, some of them were like foundering and we just couldn't get them to stop.
Mm.
And with the Steglatro, I had a few that were like within days comfortable. Is that what, did you see a similar result?
Yes, yes, she did. I would say it was about a week and a half, and her numbers continue to be high. I test her twice a year, and with the triglycerides, but she's sound and she's happy. She's inside.
That's interesting. In terms of
Mm.
like, so I have one horse on Steglatro that his insulin is still high, but he's been, I mean, knock on wood, he's been really sound. So that is interesting that it doesn't seem like it necessarily correlates to the blood work results, their comfort, I mean.
Right, right. And that, I guess, was a little shocking to me because she was sound and then her test came back and she was like, I at one point she was 120 and she
Wow.
was still sound. Yeah. Yeah. It's crazy.
Yeah. And have you had any of the issues? I know you mentioned testing for triglycerides, but I know
Mhm.
one of the concerns is that hyperlipidemia. Have you had any
Mhm.
concerns about liver issues with?
No.
That's good.
No. Mm-mm.
Yeah, and the only other issue or potential issue that I've seen is that I had one client whose horse dropped weight very quickly on it. And he kind of got ribby and lost some top line, but I know that Dr. Kellen will say that you shouldn't restrict the diet too much if they're going on one of
Right.
these drugs because it can cause them to lose weight. So,
Hmm. Yeah, we haven't had any of that either. And I weigh her hay. And when she comes in at night, I stall mine at night. She gets 5 pounds. I weigh it. However, she is on a big bale that is netted with a drum mare and a draft mule, Molly.
and she does well.
Yes, yes. She's barefoot.
That's great. Did you notice any changes with her? Like you, does she have? I guess I should start by saying, did she have a lot
Mhm.
of hoof distortion when she was sore and laminitic, or did she have pretty typical feet, or did you notice any hoof changes after getting her
Oh,
more under control?
I love that question. I love that question because, yes, it was crazy. So she had these really upright, long feet, they were just morphing and distorted. And once we put her on the Invocana, they just came right down. All the inflammation came out, and she could be trimmed, like a normal animal. It was really quite impressive, to say the least.
That's awesome. Did you
Mhm.
see the really fast growth that I sometimes see with horses that have the high insulin? Like, sometimes they just seem like they're shooting out foot, and you could trim them every 2
Yes,
weeks. Did she
yes.
have that too? Did that
And
typically,
she
or did that resolve once she was under control?
Yes, it did. Yep. Now she can be on a regular 4-week cycle.
That's awesome. Yeah, and
Mhm.
I think that's something that I almost use as not a diagnostic, but a sort of diagnostic when I come to horses that it feels like they're just shooting out foot, and obviously the soreness that
Mhm.
will correlate to that. But I have owners that say like, "Oh, well, they found it a while ago, so they're always going to have weird feet or like
Yeah.
fast growth." And I try to
Mhm.
tell them that once it's under control, they should really go back to a more normal
Mhm.
hoof growth.
Absolutely. Absolutely, she did. And now that you say that, that is interesting because I have particularly donkeys. When you say that is kind of a symptom, and completely agree, because there are times where I'll come back to a donkey that's on a regular schedule, 5 or 6 week schedule, depending on the farm. And I'm like, oh, what has happened? What has changed? Because that foot just distorts.
Yeah. I do trim a lot of donkeys, but honestly, I'm less versed in like the metabolic management of donkeys because I
Okay.
know that they metabolize medications differently. And I know that even Dr. Kellen has said their blood work results can look a little different at least
Mhm.
for like ACTH and things like that. Um,
Mhm.
but yeah, I mean, I think that that's definitely something that can warrant more investigation. I just don't have a lot of information on
Yeah.
everything in terms of the diagnostics and things like
Right,
that.
right. Yeah, I think those are big questions that, they're sorting out. There's lots of good work done on the donkeys and mules. And I'd like to also share, to go back the in between. So my vet, then I had switched vets, like from the very beginning to this next one. And we did gabapentin, metformin, Tylenol. I mean, we did it all. And really, I was looking at euthanasia or Invokana.
Wow.
And I had called, and the reason I want to share this to listeners is because now it's not a struggle. Like, my vets around here are kind of like going right to the Invokana or the SGT2 inhibitor, where before they weren't. So I had called, we have a major hospital, our university hospital said no. Another equine hospital said no, they wouldn't put her on the Invokana. Another equine hospital said no, they wouldn't put her on Invokana, and I couldn't get her on it.
Wow.
And this was just 3 years ago.
Wow.
And I had met a veterinarian that works with a local donkey rescue. And I thought, I bet he'll do it. I bet he'll do it. And I called him and connected him with Dr. Kellen via the emails. And because at this point, Dr. Kellen agreed that we were kind of at the end. There was nothing more we could really do. I had done everything that I could. And then she's like, yes, let's try the Invokana. So I called him and I said, this is my situation. I've met you. And he literally within minutes said, sure, why not?
Wow.
And yeah, it was really, really tough to find somebody to prescribe it for her. But
Yeah,
he did.
I think, I mean, even in my area, a lot of vets were hesitant when, especially when Dr. Kellen first started talking about it because it was years and years ago, years before Tufts picked up a trial. And I think a lot of people were very skeptical, but now that it has more research behind it and there are people that have
Mhm.
actually done published studies on it, it seems like you said, vets are now willing to go right to that.
Right.
Um, but so how quickly did you see the comfort return on the Invokana?
Oh, a week and a half.
Yeah, that's awesome.
Yeah. Yeah. It was really quite quick, I thought.
Yeah, absolutely. What area are you based out of?
Just north of Milwaukee, Wisconsin.
Okay. And is it
45 minutes north.
and do you typically have pretty good vets in that area?
We do. We have very good vets in our area. Unfortunately, I'm in a like a gray little zone where like the major equine veterinarians, I'm out of their radius, unfortunately. But I have a very, very good clinic that I work with, but they do all large animals, you know,
Yeah.
not just strictly horses, equines.
Yeah, yeah, that makes sense. Yeah, because I was wondering when you were talking about, calling around to all these different vets,
Hmm.
what that looked like in terms of options you had in your area. Because I know that there are some people
Hmm.
that really don't have many options for equine vets. There's some real like dead zones for that in the
Yes.
country. So,
Yes. I would agree. I would agree. Yes.
and so is your vet now, are they more open to ECIR type stuff? I know that you said they're willing to prescribe the Invokana, but are they, you know, how do they feel about that kind of approach?
Well, the vet that prescribed it for her, he just sees her on that just strictly that basis to do the testing and follow up with her. And he has referred other people, clients, because he does a mixed practice as well. So he does bovine and equine.
Awesome. I mean, that's so
And the
good. Oh,
bovine
sorry.
is more of his specialty.
Oh, okay. That's so interesting.
Mhm. Mhm.
So did you have any difficulty originally with, people kind of adopting the more like Dr. Kellen ECIR approach for the vets you're working with?
Yes, initially with the first veterinarian, quite a bit, and that's where I ended up having to go to the web and finding the ECIR group, and then I had contacted a vet that I had used in the past. No, let me back up. It was the same vet that was kind of, took me to the end of the road. Well, she had another veterinarian there. And I specifically said to her, I'm like, I have to be able to follow the CCIR group protocol with you. Like, this needs to be, me, you, and the ECIR group. And she completely agreed. And she took, I think I was with her for about 6 years until Cupcake went pretty sideways. And then she would not put her on Invocana. She said that there wasn't enough information on it,
Okay.
and um, that's when I could no longer really use her, and then I had to find somebody that would prescribe that, Invokana, and that was when I found, the other veterinarian.
Yeah, and I think that that's a lot of the objections I see to some of the protocol for ECIR is that like, well, there's not enough information on it, which is it's frustrating because ECIR has a database with
Mhm.
thousands of case histories starting
Yes.
from almost 30 years ago.
Yes.
Um and I know that it's not like I feel like a lot of the vets who know about that say, well, it's not, peer reviewed and
Yeah.
but ultimately, I mean, studies obviously cost money and sometimes they're just too slow. They're
Right.
behind what the actual evidence is showing. They don't get published before we can,
Mhm.
by the time we need the information, I guess.
Yeah. Yes. No, I absolutely agree 100% because that is the struggle. Like, I did have another vet here doing acupuncture on her. And so I even tried acupuncture on her as well. And she too was, like, they just dismiss it. And I'm like, how can you dismiss, I think, what do they say, 12,000 plus case studies? And
Oh,
I
I didn't
think that
realize it was 12,000. Yeah.
I believe it is. And so that's my comeback to anybody that's a bit, stuck with that, is I'll say there is no individual clinic, and specifically in this area, that deals with that kind of level of data and information. And, anyone that joins the ECIR group with an animal that's suffering, we have to fill out case studies. We have to fill out forms and any changes and things like that. So they just don't give free information. It's very, data driven.
Right, exactly. And I know that all of the volunteers who, help with the ECIR forum, they're always telling people to update their case histories
Yes.
and input all the information, how they can't really give specific advice
Mhm.
without having all those blood work results and like everything that the owner has already done because ultimately, they have to know that. It's not just something that we can
Mhm.
just have a shot in the dark and try something. Really, the first step of their protocol is diagnosis. So,
Yes. Yeah.
um, yeah, you have to
Mhm.
have all the information. So,
It
yeah.
is. And as a trimmer, I'm sure you see it also all the time, is like I'll give people the information and the animal is just not turning around or slowly going downhill. And I have one specific case right now, and they they were listening and hearing me, but they weren't following the ECIR things that I was sending them. And finally, it went pretty bad where they had to call the vet. And in my back of my mind, I'm thinking, oh, well, what did the veterinarian do? Because I know what they did, nothing, because you're not following the protocol, in my opinion, right? And so then the horse, ended up getting bad enough that they had to call the vet. So then they did. They started soaking the hay. The feet are turning around because they're making those changes. And like you said, you can see it in the feet either way. If it's going sideways or, you know, correcting based on, them using,
Right.
proper protocols.
Yeah, exactly. And I know I'm going to botch this, but I know Dr. Kellen has said before, halfway measures get halfway results.
Yes.
And it's not that like a lot of people, say that they're doing the ECIR protocol, but really it's so truly individual to each horse
Mhm.
because you have to adjust it based on things like the blood work and the hay tests
Right.
and each individual case. So I don't know that people understand it's not just I implemented the emergency diet and it's not working. Well, I
Right.
mean, did they really implement it? Number one, but
Yes.
also, what's
Yeah.
their
Right.
understanding of the emergency diet? But also, what happened after that? Like you're saying with Cupcake, you had to investigate more and do other changes, and it's not just, we did this and it didn't work. I
Right.
love that ECIR is willing to kind of troubleshoot and step in and keep searching for answers, which is great.
Mhm. Mhm. I would agree. They are they're a godsend to us. I mean, for sure.
Yeah, absolutely. Yeah, I mean, that's all kind of like the main questions I have, but did you have any advice that you kind of want to impart on horse owners or hoof care providers that are struggling with a laminitic case?
I think that I'm the type of person I don't leave any stone unturned, and I feel that all horse owners should be that way because I think you made a good point of like, at least try it. And I think that the fact that they just have so much data, and I don't know that they'll ask a question, they'll want your opinion, like as far as a trimmer, and we give the opinion or we give the information, the resources, and they just kind of look at, yeah, thank you, the horse owner, right?
Mhm.
Yes, thank you. And with the internet and all of this, like natural, like different herbs or whatever that isn't recommended, they kind of go that way. So that's what I really struggle with some of the owners, and that's why when I take on a case, I'm very specific about this is what I'm going to be giving you. What are your thoughts? Because what happens in my situation, I don't know if it happens to you, but I'll say, well, this is what I would recommend, right? Based on the ECIR, safe choices of food and things. And then they'll say, well, this is what I'm going to use. My vet told me to use this.
Mhm.
So it's like, okay, well, and again, back to the halfway measure or, her motto, halfway measures get halfway results, something to that effect.
Yeah.
It's true.
Yeah,
It's true.
absolutely. Yeah, for sure. And talking about, owners that aren't maybe implementing all the suggestions that we've seen to be successful time and again. I think that, I have a trimmer friend down in Georgia who has had, a hard time at times getting owners to sort of jump all in on that. And one thing that she said to one client and had told me about it was like, just give me, 2 cycles. Just give me these whatever.
Yes. Right.
8 to 10 weeks. Just do it all in for those 8 to 10 weeks. And then if we're at the same spot, that's fine.
Right.
We'll do something else. But everything else hasn't worked. And if anything, you're going to be in the same spot or it's going to be much better. So just try this and we can discuss even at the next trim if it's, progressing or not. So I kind of liked that and sort of adopted it. That was just like, listen, if this is what we're going to do, I know it might be different than what you're hearing from all different sides. Because obviously the people have opinions everywhere. Everyone's going to say something different.
Yes.
But if this is something, if I'm part of your team and we're working together, we really have to work together. It can't be at odds because of, it can't have something that's kind of sabotaging the rehab because it's just not safe or not something that's going to be beneficial for their feet. So yeah, it can be tricky, but I totally agree.
No, I like that. That's a great idea to say, let's just give it this time stamp, let's give it this kind of duration and see where we're at. I like that.
Yeah. Awesome. Well, thank you so much for being willing to chat about Cupcake and your experiences and the ESIR. And I really appreciate hearing all these experiences and just, giving hope to owners that there are things you can do.
There are for sure. Well, thank you. I appreciate it.
Of course. Anytime.
You have a great day.
Thanks. You too.
Thanks. Have a good one.
You too.
Bye.
Bye. I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoof care podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.